Today I have on the line mental health expert Pettina Stanghon. Pettina is a counsellor, clinical hypnotherapist and psychotherapist, and she co-owns Noosa Confidential in Queensland, which is a rehabilitation and treatment centre dedicated to a holistic approach to mental health. Today Pettina is going to talk to me about the alternative treatments to mental health and the holistic perspective to treating it. Is that Pettina on the line?
Yes, I'm here.
Beautiful. What I want to get into, I've talked a little bit about your clinic, but I wanted you to actually give us some sort of perspective, because I know so many people have trouble, especially when they've got a loved one or they're at the end of their rope with themselves, with any kind of mental illness, whether it's depression and anxiety. And so I really wanted to draw attention to what you do, because it's a little bit different. Can you explain, please?
Yes, of course. We treat depression and anxiety and addiction, but we, rather than just approaching it from a talk therapeutic approach or a pharmaceutical approach, we look at the bigger picture. So we have a number of specialists. We address hormone imbalances. We look at pathology, looking for something called methylation or a genetic disorder called pyroluria, which massively impacts mental health. So
Is that common for people to have that?
Incredibly common.
Wow.
Incredibly common. In fact, a study's been done, which is a 30-year study by a professor called Walsh in the States, and it was actually done through the prison system, and a staggeringly high percentage of the shootings that have happened across the States and violent crimes, etc., are by people that are highly medicated and have got pyroluria. And when you have pyroluria and you're medicated, it actually has a counter effect, and therefore you can have violent suicidal ideations, and it doesn't kind of help you the way most pharmaceutical medications are meant to for depression and anxiety. So actually screening for pyroluria, which is what this particular professor is trying to do at the moment through the PBS in the States, is vital, because so many people don't respond to meds the way they're meant to if they've got pyroluria. Wow.
So as part of your treatment that you get people in, you do this, and what else do you do?
We teach them mindfulness. We have two programs. We have a residential program, and we have what we call a pre-program, which is a remote program. So you don't have to come to one of our centres or our residences. We have naturopaths, we have integrated doctors, we have registered psychologists who are also integrated. So by that I mean they are fluent in talk therapy, they're registered with their associations, but they also study yoga and mindfulness. They work with our naturopaths and our doctors, so that when they're working with people with pyroluria or methylation or hormonal imbalances that are contributing to mental dis-ease, then they can work together. So it's not a one-pronged kind of approach to well-being.
And do you support people who are already obviously on the conventional medications?
Of course, yeah. Look, most of the people that come through our programs are already medicated, and they are either wanting to come off medication long term, and that is a slow process, and we supplement if somebody wants to and it's appropriate for them to come off medication, then we can supplement it both nutritionally as well as with herbs, vitamins, supplements, and we do supplements that are specifically made for that client. So we're not kind of just grabbing things off the shelf. We along with the pathology, we send it off to a lab here in Queensland, down near the Gold Coast, and they actually make up supplements specific for that client.
I've heard a lot of information that, inflammation in the brain can have a huge effect, and things like vitamin C and turmeric can be really helpful.
Yeah, I actually just posted on one of our Facebook pages today a study from an integrated psychiatrist in the States, and absolutely whole turmeric, so not the isolated turmeric, but the whole product. I'm on it myself.
Mm-hmm. So what do you mean by the whole product?
So pharmaceutical companies tend to focus on isolates. I mean, most of the meds, or many of the meds that we have commonplace, right down to aspirin, is obviously from a plant originally. And Western medicine has focused on isolate, and I'm not a naturopath, I'll say that up front. I just work very closely with a lot of them.
So you're meaning like the curcumin part?
Exactly.
Of it, yeah.
So they extricate the curcumin and they say, there you go, there's the active ingredient. Now, what they've actually found is that the whole plant of turmeric is more effective than the isolate, and that actually is common in a lot of supplements that we and it's we're unable to explain the why. It's except to say that the whole product has active ingredients, but then other cofactors that are having a better effect in terms of inflammation in the brain, assisting with regulation of inflammation for things like arthritis, and also having an effect on mental health subsequently. The whole plant, and there's two products that we use. One is the isolate and one is the whole plant, and the whole plant is highly effective, more effective than the isolate.
Wow. And I know that, generally most people believe that when it comes to, say, depression, that it's just about a lack of serotonin and only medication, antidepressants and maybe some counselling can help. What's your perspective on that?
Serotonin certainly plays a role. Is it an imbalance in the brain? No, that's a really simplistic perspective, and we just know that that's not accurate anymore. The efficacy, if you want to really look at the efficacy of antidepressants and anti-anxiety meds, it's really low. In fact, placebos are as effective in peer-reviewed scientific studies as many of the pharmaceuticals. So am I saying don't go down that road? No, absolutely not. For some people, it's highly appropriate. But is it all about a chemical imbalance in the brain? No, it's also about serotonin uptake. It's also about synaptic gaps. It's also about hormonal uptake. It's also massively about gut health. And what we know with a lot of anti-anxiety and antidepressants is that they interfere with gut health and actually reduce it. And we know that when we have, through that gut and psychology syndrome protocol, that when we work on gut permeability and gut health, that has a massive effect on mental health. So unfortunately, a lot of the pharmaceutical drugs compromise that gut health, and so we have people going downhill when they're on the pharmaceutical drugs instead of improving, as well as then getting insights into what their triggers are in their everyday life. So
you're really looking into all aspects of the person to make sure that it's not only just the medication, but
there's never one thing, and it's just too simplistic to say it's one thing.
No, well,
it just isn't.
We're too complicated, aren't we, for that?
Absolutely, and complex for sure.
Yeah, and so people feel, are you just treating people in Queensland, or is this something that's available for more people?
No, look, we work closely with a lot of the FIFO programs, so right across Australia, Western Australia, Far North Queensland. Our residential programs cater predominantly for interstate and international clients. And because we have the remote program, which means as long as you've got a computer or a phone, we can have pathology done anywhere. We liaise with a number of GPs all around Australia to have regular pathology done. You can really live anywhere and do some degree of our program.
Oh, I think it's just fantastic because it is a really tricky condition to have. What kinds of conditions do you normally treat at your clinics?
I would say depression and anxiety are what people present with the most frequently, meaning when they pick up the phone and call, it's depression, anxiety and addiction. We do a lot of eating disorders, which generally go hand in hand with with depression or anxiety as well, and relationship challenges. But yeah, on the surface, addiction, depression, anxiety would be the top three. But as I said, it's really a matter of people kind of people becoming empowered and learning that it's not that they haven't got the skills to cope with life. It's that kind of everybody else seems to be coping except for me. Events happen, and as we all know, events are going to happen for the rest of your life, stressful events, and how you respond and how you can then maintain wellness are sort of two key points. What you eat, what you drink, how you move and what you think are the foundations of well-being. So we teach that and then explore looking for some of those other contributing factors to, which most people are unaware of. Pyroluria is a genetic condition. So as you would know, a lot of people will say, oh yeah, I've got anxiety and, my mum was an anxious person and her sister, had postnatal depression, and you start tracing back through a family and notice that there's a pattern there. And it's just about uncovering that so you know more about your predisposition.
Wow. Well, I think there's some really amazing information there, and it's really good to people can feel empowered with what they're doing and take their health into their own hands.
Absolutely, I agree.
So if people want to find more information on your clinics, where can they find it?
We've got a website, which is all the W's, noosaconfidential.com.au. And that has links to all of our other websites as well. And we're on Facebook. Noosa Confidential is on Facebook. And the Integrated Life Centre is also on Facebook.
Beautiful. Thank you so much for talking with me today, Pettina.
No problem. Thanks for your time.